heart diseases claim around 225 lives a day in South Africa. That's a lot of people. Half of them are under the age of 65, but experts say 80% of those deaths can be prevented. This can be achieved through exercise and healthy eating. Let's discuss this then with Dr. David Jankelow from the South African Heart Association. Doc, good morning. Thank you for talking to me. So we're talking in the context of, the passing away of the journalist at City Press who passed away a few days ago. And he was an avid runner in his early 40s, Thulasizwe Simelane. And when I heard the news, I was quite shocked because I knew him personally as well, and I can vouch for his active lifestyle that he was living. And I suppose the question that puzzles many people when an event like this happens to someone to be living healthily is to say, what could this person have done to avoid dying of a heart attack?
Thank you very much for the opportunity, and good morning to all your viewers. First of all, I'd like to wish the Lubisi family my and our association's condolences. Whenever such an event takes place, it's extremely tragic when such a young man is cut down in the prime of his life. So that is extremely tragic. So you make a good point. He was an avid runner. Heart disease is the biggest killer in the world. It kills up to about 225 South Africans every single day and 40 to 50,000 people worldwide. It globally claims up to 18 million lives. So you're right that a lot of heart disease can be prevented. Prevention is better than cure. Obviously, he was an active runner, but we don't know about his other risk factors. Exercise can raise your risks of a cardiac event if you've got underlying serious heart disease. Now, below the age of 30, when people die during exercise, it's usually due to a genetic abnormality called hypertrophic cardiomyopathy, where there's inappropriate thickening of the heart muscle, and that can lead to dangerous rhythm abnormalities. Above the age of 30, patients, these individuals usually have serious underlying coronary disease. And to put it in perspective, the heart's a pump, it pumps blood and oxygen. When you exercise, the heart needs to supply more blood and oxygen to all the muscles and tissues that require it at that point in time. But the heart has its own blood supply, and there are three little arteries that supply the muscle with blood and oxygen. And when you suddenly block one of those vessels, one has a heart attack. Now, the occurrence of a heart attack is still fatal in approximately 5 to 7% of patients, and 50% of those who will die because of a heart attack may well die within 1 hour of the onset of their first symptoms. So the first symptoms may be the last. We treat many patients with heart disease. We give them emergency treatment. The first aid is to get the artery open as quick as possible. But whenever such an event takes place, it reminds us that this can be a catastrophic and devastating disease.
Doc, so without obviously speculating about the circumstances of Thulasizwe Simelane passing and the heart event, cardiac event that led to his death, I'm also curious about, because in his case, this was someone that I'm saying that, whose lifestyle many of us will say we can vouch for. You then ask yourself, though, does it need to have been a condition that a person was predisposed to previously? That, many people will say, I didn't even know that such a person could get a heart attack. I didn't even know that previously perhaps they may have had a cardiac event. Does it necessarily need to be such that you've had a hint of sorts, heart difficulties and arrhythmia of sort previously and came out of it okay, such that, going forward, your risk of dying at the next event are heightened because you've had previous events?
So, as I said to you, you don't necessarily have had to have had some indication beforehand, but it reminds us all those of us in middle age that are physically active, that we should be consulting our general practitioners, our physicians. We should be addressing all our risk factors. If one is a smoker, one needs to stop smoking. If one has high cholesterol, one has to go on a good diet and then consider with your physician whether you need to be on cholesterol lowering medication. We know that the lower you get your cholesterol, the less events there are. If one's hypertensive, one that we need to treat that and make sure that the blood pressure is controlled. Diabetics are very, very important. They have a much greater risk. So if one's diabetic, we need to be on a good diet and make sure our diabetic control is good. We need to observe a good diet. We need to try and lose weight, all of us. There's room for improvement in all of us. But yeah, as I said to you, those of us that are physically active, we should be going for an annual physical or biannual physical. Good history needs to be taken with a good clinical examination, and then perhaps a stress ECG should be done. And when we put people on the treadmill, we're looking for ECG signs that the underlying arteries are blocked. And often issues can be picked up at a routine examination before they become catastrophic.
I think that's an important message, is it not, Doc? Because I'll tell you now, as someone who tries to live an active lifestyle and watch what I eat, you sort of get this false comfort that says, I should be okay. So what you're talking about, the routine checkups where you are put on a treadmill, that's not something that many of us would ordinarily think about. I think that's an important message, is it not?
The other thing which is important, it's on the 29th of September last month, it was World Heart Day, and we had Angina Awareness Month, where a lot of us were speaking to the media to remind people of what are important symptoms, so that your viewers, those that are experiencing shortness of breath, discomfort in the chest, especially with physical exercise, dizziness or fainting, they really should be consulting their physicians to make sure that there's no problem. There's no cause for panic. There's never a reason to panic. We just need to deal with things systematically and to make sure that there isn't an underlying problem.
Yeah. And lastly, Doc, when we see an event where a person of Dumisane's age, passes on at such a young age, relatively, early 40s, you then ask yourself, is there a particular demographic that is highly at risk? I mean, in the wake of the shock of it all, you hear people talk about perhaps men in their early 40s are particularly at risk. Is that necessarily the case, though?
Not necessarily, but those that die like this have got serious underlying heart disease. And I think it's your viewers and the population, those particularly with symptoms, should not be ignoring symptoms of shortness of breath and chest pain. They should be seeking care, and they should have a careful evaluation. But even if we're asymptomatic, from time to time, we all need a routine medical examination to address risk factors and to make sure that there's not an underlying problem. As I said to you, those that die below the age of 30, 35 usually have a genetic abnormality. Those above the age of 30, 35 usually have underlying coronary artery disease. But there can be lots of causes of sudden cardiac death.
Yeah.
And it's extremely tragic for somebody to leave a young family in the prime of their life.
Yeah, absolutely, Doc. Thank you so much. I really appreciate it. I thought maybe, this is a conversation we should have. In honor of Dumisane Lubisi, to basically raise awareness about this particular situation that led to his death. Just lastly, Doc, what is the role of stress in it all? Does stress factor in at all in heightening the risk of having heart difficulties?
Well, emotional stress can raise your risk at a particular time. But, the stress is kind of overdone, because when I see patients who come to see me and they're smoking 30 to 40 cigarettes per day, I ask them, why are they smoking? Because they say the stress will kill me. Now, what's adaptive in you might be maladaptive in me. How do we avoid stress? It's very, very difficult in 2020, especially in what the world has gone through over the last 9 months. We can't avoid stress. We know that cardiac patients that have underlying depression are at much greater risk. So I think those that are particularly anxious, feel depressed, they should be having those syndromes or symptoms addressed by their general practitioner or possibly a psychologist. That could help. But it's not, this emotional stress is not the be-all and end-all of everything. We think it is, but it's not.
All right, Dr. Jankelow, thank you so much. I really appreciate your time. And I must just take this opportunity to really pay my tribute to Dumisani Lubisi, the late Dumisani Lubisi there. This interview hits home for me because, you think we will take a theme that comes out of this event and this tragic passing of this young person and raise awareness around some of the issues. But actually, it does hit home for me because I knew him personally. He was an avid runner, and I ran with him 1 or 2 times. Actually, at some point, we were neighbors, and in the short space of time that you spent with Dumisani Lubisi, you just knew the love he had for his 3 boys, and that's all he really talked about. And I've seen in the tributes that everyone has been paying that he really loved those boys, and now they are left without a father. So our condolences to the Lubisi family there. A really great man has passed on, a gentleman of the journalism profession and an avid runner. And of course, I would run past his house when we were neighbors, and I always had at the back of my mind that if I run into problems and I can't complete my run, this would be my place that I would go to and just basically knock on the door and say, Ekhaya, Galubisi, please help me. Rest in peace, brother.